By Sir Patrick Vallance, who's in our Westminster studio. Patrick is the Chief Scientific Advisor to the Prime Minister. You also chair the Scientific Advisory Group for Emergencies. We've seen more than 100 deaths in Italy, a rise today in the UK of so-called community transmissions, which means it's almost impossible to trace the source of the virus when somebody has got it. Do you think you will decide tomorrow that containment has reached its limits and we've got to move into the so-called delay phase when it comes to limiting the harm this virus can do to us?
Well, the first thing to say is that actually the contain phase is also part of delaying it. So there's no absolutely hard boundary between the two. So the measures that are in place to try and contain it will have an effect on delay. Sure. And this is clearly a global thing. It's not unique to the UK. And therefore, part of this is when the World Health Organization decides that it moves from contain to delay, because that should ideally be a global response. Failing that, we're keeping an eye on when we think we do reach that stage ourselves, and we'll make that decision.
Could it be tomorrow?
With other countries as well.
Could you make that decision tomorrow?
Well, we'll make that decision at the time we need to make it, based on the way in which the epidemic's evolving and the modelling that we have that tells us the right time to take the next steps that we need to take. And there's no point moving to things much earlier than you need to. I mean, timing is really critical in this sort of outbreak, where you move too early, you cause a lot of disruption, and actually you take measures which people can't sustain for a long period, and you start to lose the effect of them. And obviously you move too late and you miss the opportunity. So getting the timing right on this is crucial. We work with mathematical modelers to try and understand when that could be. There's a surveillance system that's now in place that Public Health England are running to try to understand where we are in terms of the outbreak. And so we monitor this obviously every day. We're looking at it all the time to try and decide what the right time is to make decisions.
Now, two countries where there have been significant outbreaks, Japan and Italy, the rise in numbers affected has been way faster. It's grown way faster in Italy than Japan. Do you understand why Italy has suffered far worse than Japan?
Well, I can't be sure, but I think the first thing to say about any epidemic is that things tend to double. So the doubling time of an epidemic is the key thing. And the doubling time in Wuhan looked as though it was something around 5 days or so. It might be a bit longer or a bit shorter. And of course, the longer that things go undetected, the more doubling is going on before you pick it up. And doubling from 5 to 10 doesn't sound like very much, but when you double from 1,000 to 2,000, then things obviously take off very quickly. So I think one of the questions is whether detection has been adequate in places
like Italy,
and therefore where you get some rapid expansion before you get control and you're able to actually identify cases and implement the containment.
It was just whether there was anything that Japan was doing to contain that we could learn from.
Well, I think Japan was on it quite quickly. They've taken a series of measures to identify through contact tracing, and I think we're doing very, very extensive contact tracing through Public Health England, and they're using the usual things of case isolation once you identify somebody, making sure you've got testing to make sure people have returned to negative. And we're doing all of those things, and of course are in regular contact with all sorts of other groups looking at this across the world, Singapore, Hong Kong and others, learning from them what they're doing and sharing information. And that's, of course, why it's so important that the science is at the heart of this, because the scientists can share information, find out what works, make sure that we update our own information and indeed our own models with the new information as it comes through.
Italy has announced the temporary shutdown of schools and hospitals today. Sensible?
Well, shutting down, there are a series of measures you could take.
Sorry, schools and universities. Sorry, I suddenly realised I said hospitals. Forgive me.
Yes. There are a number of measures you could take. And in an influenza epidemic, shutting down schools is often something that you might want to do quite early, because we know that the transmission occurs through children very often, and you get a big amplification of the outbreak. Now, in this illness, the children actually get a very, very mild illness and certainly aren't at anything like the risk of older adults. And we don't yet know whether that's because they don't get it as much or they simply don't get the signs and symptoms. And when we think about the measures you could take, there are a number that have been laid out, which, you look at things that other countries are doing, no mass gatherings, school closures, isolation of cases, household quarantine, social distancing measures. These are all measures which we've modelled and we look at to see which is the most likely impact to have and at what stage you need to get these measures implemented and in what combination. And so those are the things that we're doing at the moment. And in that, school closures is one of the things that people look at. It's not the most obvious or necessarily the way in which you get the most change. The other thing to say...
Could I just ask, since we mentioned schools, quite a lot of parents are worried about children with asthma. Lots of children have asthma. Are they more at risk?
Well, respiratory tract infections can always be a bit of a risk for children with asthma. So that's true for respiratory tract infections in general. There's nothing particular here that says this is more risky. Okay. And in fact, as I say, the evidence so far in children is they have a very low infection.
Okay.
A very low evidence of becoming symptomatic with it. So we don't know whether it's low infection, but they seem to get very, very mild symptoms.
And this other issue about whether or not one would become immune if one gets it and recovers, what is the evidence there? Do we get a build up an immunity?
Well, you'd expect to. And of course, it's much too early and we don't have enough information from patients yet and we don't have the right tests yet for knowing whether somebody's developed antibodies. But you would expect with this virus, as with other similar coronaviruses and other infections, that you would get an immunity and that most people would then end up with some immunity that would last for some period. I mean, you can't
so there's a lot of
years.
I mean, there's a lot of scaremongering that, people are going to get it again next year if they've had it this year. That's rubbish as far as you're concerned.
Well, it's likely that people get immune. I don't know how long the immunity will last for. And so clearly, if you take the example of influenza, you have to look at each variant each year and decide what vaccine you're going to get against that. This we wouldn't expect to mutate so readily. You might expect to have a longer immunity. Okay. Those are unknowns at the moment, but that's what I would expect.
Which brings us on to the other issue that people are obviously very keen on, which is the issue of a vaccine.
Yeah.
Realistically, what's the earliest we will see a vaccine?
I think a vaccine that can be used generally, we'd be very lucky to get one within a year.
And if it's available, would the advice be that everybody should have it?
Well, I think there's a lot of ifs in that. And clearly what you tend to do with a vaccine, if you've got an effective vaccine, and there's a whole question about how much of it you can manufacture and how much you can make available. But what you tend to do is try and protect the most vulnerable first, and then grow it as you need to. And the same principles taken with influenza vaccination. Now,
one of the things I understand that you and your colleagues believe is that actually transmission is more likely to take place, not in sort of enormous pop concerts or football matches, but actually in places like pubs and restaurants. But desperately difficult to shut down pubs and restaurants, I would imagine. Or can you do social distancing measures to protect us that would temporarily mean that we would be told, don't go out and enjoy yourself at a restaurant?
Well, the social distancing measures that have taken place elsewhere have included advice to not go out and make contacts beyond the ones you absolutely have to. So there are variant degrees of social distancing which people can look at. But it's worth, if you think about what happens, anyone who's infectious will be shedding virus. And that virus can either have a high probability of infecting a small number of people in an enclosed environment, and in a way, the first group we saw of the ski chalet people in the UK was that example, or a very, very low probability of infecting people in a large gathering. And so you don't actually solve the problem. One person in a 70,000 seater stadium is not going to infect 70,000 people. They're likely to infect the few people around them that they're in direct contact with. And the same is true in small gatherings. So the point is, that you can be infected through either of those mechanisms. And of course, it's not possible to say you can't make those sorts of contacts. So social distancing measures are about things that you can practically do to try and avoid maximum contact if those are ones that we choose to implement.
And then just very finally, and this is a big question, but I wonder if there's a way of answering it sort of speedily. Does your committee, the Scientific Advisory Group for Emergency, look at the balance between saving lives and economic and social costs, or do you leave that to the politicians?
We don't. We look at the things that we can that we think make the biggest difference in terms of public health, altering the shape of the epidemic, reducing the peak, pushing it out a bit so it goes into the summer months, and that's what our job is, to look at the science of this.
But the costs of telling businesses they've got to close down, that's something that the Chancellor and the Prime Minister have to decide.
Well, we don't look at that, but we do look at the behavioural consequences of are these things doable? What are the behavioural consequences likely to be? Can people actually do it? So if you shut schools and then all the children aggregate because they go and play in the playground all together closely anyway, those sorts of things we look at as part of this, but we don't look at the decisions which are to do with the economy, and that's taken elsewhere.
Thank you so much for joining us. I know you're sort of working day and night at the moment on all of this, and we're very grateful.
Thank you.